Picture this: you're a fit, young and healthy athlete. You're at the top of your game. Then one day, when you're out on the field, your heart begins to race, your vision seems blurred, and then suddenly everything goes black. Sudden cardiac death is the #1 killer of young, competitive athletes in Australia, with up to 500 healthy and often extremely fit young people dying each year. This shocking medical condition is more common than we think, and for most of us, it's one that we've never even heard of. Just last month, 27-year-old Chris Haddad, a known fitness enthusiast, died suddenly from a cardiac arrest in this year's City to Surf. This tragedy has drawn fresh attention to heart conditions that are killing young, fit people. Dubbed a silent killer for most young athletes, the first symptom is usually death itself. Professor Chris Samsarian is leading a research lab at the Centenary Institute at Royal Prince Alfred Hospital in Sydney. His team believes that most of these deaths are caused by faulty genes and that there's a 1 in 2 chance of inheritance by other family members. Professor Samsarian says hypertrophic cardiomyopathy, a genetic condition that leads to abnormal thickening of the heart muscle, is the most common cause of sudden cardiac death in young athletes, affecting 1 in 500 people. He believes that sport can stimulate most underlying heart conditions.
So one theory is that these high levels of exercise, the fast rhythm, the adrenergic stimulation when they get very emotional and excited when they exercise, could be a trigger. These are young, healthy people. These are young kids who go to school and never come home. These are kids that go to sleep and the mum hears the alarm clock ringing in the morning, she goes in and the child is deceased overnight. These are the worst possible tragedies.
Chris Ebling is your normal 18-year-old boy. Attracted to the push and shove of rugby union at 10 years old, his world was soon turned around when medical examinations of a neck injury led doctors to discover that he had a coarctation of the aorta. This is a narrowing of the heart's main blood vessel and life-threatening if left untreated. For Chris, his condition means that despite multiple surgeries, every 6 months he has to see a specialist, and every day he has to take a beta blocker to lower his blood pressure. Without doing so, he could face a prospect of an early death.
Well, when I first got diagnosed, I couldn't play any sport for a whole year, and then the year after that I could only play soccer because of the stent. They didn't want any contact on it while it was growing into my body, my body grew around it. So it still affects me today. I've just got to monitor it, and at one point there's going to become a time where I'm going to have to make a decision to keep playing footy or stop because the risk might get too high.
It's estimated 10 young Australians a week. That's 10 apparently young, healthy and fit athletes are dead suddenly and without notice. In Italy, there's mandatory screening for all competitive athletes, and this has lowered the death toll by 89%. So why is Australia lagging so far behind? Professor Samsarian and his research team believe that the problem is a lack of awareness among the Australian community and knowledge gaps about some of the causes of genetic heart conditions. So, the question is, if we aren't even aware of how many young lives this silent killer claims, then how are we expected to act in the first place?
How do we prevent young people dying suddenly? It's really 3 ways. One is to modify their lifestyle and tell them to avoid the highest level of competitive sports because that seems to be a trigger for sudden death. Secondly, sometimes tablets can help. Things like beta blockers can help. So the third way we can prevent sudden death in young people, the most definitive way, is implantation of one of these devices, which is called an implantable defibrillator. We make a little incision, it's implanted under the chest wall, and a wire comes out and into the heart and monitors the heart rhythm every beat of the day, every week, every year. And if the heart goes into a rhythm that could lead to sudden death, it actually detects it and then delivers an internal shock, an automatic shock. And so we know these devices save lives today, at all ages, not just young people.
However, Chief Executive of the Heart Foundation New South Wales, Kerry Doyle, believes it's important not to send mixed messages to the community. Although sport is a proven trigger of most underlying heart conditions in young athletes, she believes physical activity is critical to health, but thinks it comes down to knowing your own body.
What we say to Australians is to get a heart health check. Understand what your risks are, understand your family history, understand your lifestyle factors, and then you'll know whether it's safe for you to do any level of activity. But as a general rule, physical activity will save your life.
Research teams like those led by Professor Samsarian hope that in the near future enough of our genetic makeup will be understood to lower the death toll of young athletes dying suddenly in our community. Melissa Haddad, UTS News.